Keep watching if you're worried hip replacement is in your future. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. This video is all about helping you treat stiffness in your hip at home easily with very little equipment. The major reason why people go into hip replacement surgery is because of hip arthritis. Hip arthritis is corollary to weakness and stiffness. But often stiffness comes first, and particularly the motion of internal rotation. Internal rotation is when you bring your foot to the outside of where your hip is. I know it sounds like it's external rotation, but it's actually internal because of where the leg bone is. And so we see internal rotation all the time. When we walk, every time we stand on the leg that's bothering us, and then we advance the other leg, that's internal rotation on the stance leg. Where this comes up is if you're trying to get in and out of a car or up a step or on a stair, and you're noticing it's weak or stiff, like it's getting harder and heavier to do. Getting into bed, getting harder and heavier to do. These are all things that indicate the hip muscles are getting weak and the joint is getting stiffer. And you probably have hip arthritis that's getting in the way of that. But don't worry, this is a great video to help you understand what are simple exercises you can begin to do to help open up that stiffness, and you can avoid hip replacement in the future. All right, this first exercise, all you really need is a chair. A few steps on a stair will be just fine, but any standard height chair will be fine. Now, I have a strap tightened up into his hip. You don't have to have a strap. If you're at a place that you can apply one, great. I like it a lot because it helps to get the angle of pull that we're looking for, but you don't have to have one. What we're gonna do when we're up in this position, we're getting a lot of hip flexion, which is gonna be helpful for bringing the knee up, and then he's gonna actively push his knee in. So he's using his muscles to push his knee in while his foot is fixed on the chair. In this case, we have a box. We're gonna do this 10 to 15 times. At the end of that, he can then go into a little overpressure where he's gonna push on the outside and try and bring his knee inward. Now, if you feel like you need a little bit of help with balance, you can use another chair right here. We can hold on to it, but we're getting some flexion and internal rotation to help open up the backside of the hip. 10 to 15 reps each direction. You can hold 2 to 3 seconds. It's not really a long hold, but just a simple hold for 2 to 3 seconds. Often I'll say just do 1 to 2 breath cycles as you hold. Those are easier to count typically. And you can do this 2 to 3 times a day to help unlock those hips. If you're doing exercises, it's a great thing to do prior to squatting. You'll notice a huge difference in your ability to get at depth and get at depth comfortably by doing these exercises. I highly recommend you do these on both sides. If one hip is getting stiff, the other one is similarly getting stiff, you will notice one might be stiffer than the other, and that's totally fine, very, very normal. Maybe spend a little bit more time on the stiffer side than the other side. That'd be totally appropriate. If as you're doing this, you're feeling a lot of pinch in the front, try and stand up a little taller and come out of flexion a little bit more, or get a step that's lower. That may need to happen because what's going on here is we're getting a lot of stretch and pull across where the femur bone comes up into the socket. We can get a little bit of pinch along this top rim. And so if that's the case, have them stand up a little bit taller, come out of that flexion a little bit, so we still get the rotation that we're looking for without the pinch or grindy. This next exercise, I like to get you down to the ground or the floor area, get some cushions for your knees. You can do this on the bed, that'd be totally fine. I like to add the strap for this move. You don't have to have the strap, but I like to add the elastic strap. These are easy to buy on Amazon. This angle of pull really helps to lock in where a lot of this restriction is, so we get a little bit more benefit, a little more bang for our buck in terms of the time that we're spent doing this exercise because of the strap. And so what we're doing here is he's going to elevate his leg a little bit and then internally rotate his leg. And again, I know it's going out. It sounds like external rotation, but he's internally rotating on his femur. Again, doing this with a band, it gets a little bit more pull and a little bit more pressure across the muscles that are tight, so we get some flossing across those tight muscles in his hip. It's a lot of these ones that are on the groin and kind of upper thigh muscles that get really tight and contribute to that restriction. And so we're flossing, or what we call an active release technique, where we're flossing those muscles with the pressure in this position. Again, if we're getting any pinchiness in the front, you can kind of lean forward a little bit more and it'll take some of that pressure off. If there's no pressure, you can actually lean back, and the more you lean back and do this move, you'll feel a bit more stretch. That can be a little bit more challenging. Do this 10 to 15 repetitions, 2 sets. And if you want to get a little bit more stretch into this position, you can sit back onto your heels. You can also come back forward, internally rotate the hip, and leave it there, hold there, and then sit back. Leave it there and sit back, and you'll feel a bit different stretch. Again, no pinching in the front. As you sit back with the hip internally rotated, you're going to get a bit more stretch all across this backside glute to help open up all that internal rotation. which is so imperative as we walk to make sure we don't have a lot of hip pain or a lot of knee pain because of the restriction we're getting at our hip. So here he is doing it without the band, totally fine. We're actively internally rotating the hip. And then if we're going to get a little bit more mobility out of this, you can hold or pause there and then sit back and feel a bit more stretch across the backside into his glute area. And for this hold, 5 to 10 seconds, 5 to 10 times is an easy dose just to mobilize. Really good dose for pre-workout or any kind of pre-exercise. If you're going to do like end of the day or just trying to stay mobile, you can hold for 15 to 30 seconds. Just make sure we're avoiding any pinching in the front of the hip. Being in this position is bothersome to your knee. Feel free to add more cushions. Keep it very, very light. If it's still bothersome, you can bring the cushions down into the shin area. You're still going to have plenty of support from there, but just try and keep pressure off the knees, especially if you've had knee replacement. The more cushions you have, not necessarily right under the knee, but just below the knee on the shin area, a few pillows down there will be really helpful and still allow you to do the exercise. Give those exercises a try if you're having stiffness in your hip or starting to feel like you're worried about hip replacement might be in your future. It's a great way also to test how your hip internal rotation is going. If you're having a lot of restriction there, then that's a great place to be to help improve your mobility. One of the major reasons people have hip replacement is because of stiffness. That stiffness leads to pain, and pain leads to replacement. If after watching this video you feel like you can't do those exercises and are still worried about hip replacement, there's still time to avoid hip replacement by getting active. If you have more questions, feel free to give us a call. We'd love to help.